الآن رح ننتقل لموضوع جديد اللي هو pneumothorax hemothorax. When parietal or visceral pleura is a branch and the pleural space exposed to positive atmospheric pressure, air or blood accumulated in the chest cavity, which means that air accumulation between parietal and visceral pleura, pneumothorax, and when the blood accumulated in the chest cavity, hemothorax. The intrapleural pressure, as we said previously, should be negative in order to work as a suction for the lung and to keep the lung open, hold the lung open. When this pressure exposed to atmospheric pressure, a positive pressure starts to build inside this space so that we cannot keeping the lung open, so that the lung collapse may result. There are different types of pneumothorax or hemothorax. Simple pneumothorax, traumatic pneumothorax, tension pneumothorax, or with the pneumothorax hemothorax may develop. يعني مع تراكم الهواء ممكن يكون في عندنا injury ويتراكم البلد وبالتالي يصير في عند المريض hemothorax. So that the most severe and negative consequences for this defect is the collapse of the lung. Simple pneumothorax, spontaneous, in which the air enters the pleural space. This may occur among healthy and among patients with chronic obstructive pulmonary diseases, COPD. Traumatic pneumothorax, laceration in the lung or from wound in the chest wall, ribs fracture, كسور للضلع, stab wound, جرح في السكين, invasive thoracic procedure like central venous line. All of these, in addition to the pneumothorax, may lead to hemothorax. Open pneumothorax, air in and out in each breath. بدخل الهواء مع النفس وبطلع بكل مرة. So that the lung collapse and result in shifting of the heart and the great vessels to opposite side during inspiration and to the injured side during expiration. إذن في مراحل الانسبيريشن الشهيق على سبيل المثال لو كانت الانجري من الجهة الشمال راح يصير في شيفتنج للهارت والجريد فيزل خلال الانسبيريشن للرايت سايد وبالاكسبيريشن بترجع to the opposite، بترجع لمكانها. ليش؟ لأنه دخول الهواء من مكان الانجري رح تعمل pressure على الهارت والجريد فيزلز pushing the heart and the great vessels to the opposite side. while during expiration لأنه الهواء رح يطلع برا رح يخف البريشر رح يرجع الهارت والجريد فيزلز لمكانهم وما بيتحركوا من مكانهم لكن بصير في push عليهم. The most dangerous and severe condition of a pneumohemothorax is the tension pneumothorax, in which the air enters during inspiration but cannot escape during expiration, in which there is a one-way valve occurs. راح يتكون عندنا صمام باتجاه واحد يسمح بدخول الهواء خلال الانسبيريشن ويمنع خروجه خلال الاكسبيريشن. So that this one-way valve permits that the air entry during inspiration and preventing the air to escape during expiration, building a positive pressure with each breath so that lead to lung collapse and shifting the heart and the vessels to the unaffected side during inspiration and expiration, because there is no relieving of the pressure during expiration لأنه ما راح يكون خف البريشر خلال الاكسبيريشن لأنه الفالف راح يسكر وبالتالي البريشر قيمته راح تظلها عالية. Here in this picture we can clarify the differences between open pneumothorax and tension pneumothorax. في الصورتين اللي من فوق في عنا inspiration and expiration in open pneumothorax. In open pneumothorax, the air will enter toward the right lung during inspiration, and the lung or the right lung will collapse. In addition, the heart and the great vessels will shift it to the opposite, to the left side, making a compression on the left lung during inspiration أو خلال دخول الهواء. While in the opposite picture, on expiration, في مرحلة open pneumothorax, the air will escape from the injury site so that the lung will regain its nearly normal size. راح ترجع لحجم تقريبا نصف الحجم الأساسي اللي إلها، لكن ما راح ترجع للحجم الأساسي. And the heart and the great vessel will shift it to the opposite side, to the injured side. إذن في مرحلة الانسبيريشن بدخل الهواء، lung collapse، the heart and the great vessels بتحركوا للجهة المعاكسة. في الاكسبيريشن الهواء بيطلع، اللنج بتحاول انها تعيد حجمها للوضع الطبيعي لكن ما بتعيده، الهارت والجريت فيزلز بيرجع لمكانه الصح. لكن there is a difference with the tension pneumothorax in which the air entry during inspiration making a lung collapse in the right lung, and the heart and the great vessels will shift it to the left lung, and the heart will compress the left lung. While on expiration there is a one-way valve, this valve will be closed and the air will still inside the right lung, will not escape from the right lung collapse. Also the heart and the great vessels will still shifted to the left lung, compressing the left lung, so that with each breath there is an increasing pressure. خلصنا من الاكسبيريشن، بنرجع للانسبيريشن، برد بدخل هواء اخر بزيد البريشر. في الاكسبيريشن برد بسكر. بالنفس الثالث بفتح الفالف، بدخل هواء، برد بسكر. بالاكسبيريشن بيجي بده يطلع، ما بيطلع. still inside the lung, making a high pressure inside the pleural space, increasing the chest cavity pressure, preventing when the pressure inside the chest become higher than the atmospheric pressure, will be a stop of entry of the air through the nose, through the trachea, toward the chest, stop of breathing, no auscultated breathing sound, and respiratory arrest may result. Pneumothorax, hemothorax manifestation: sudden pleuritic pain, anxious patient, dyspnea, air hunger, increased use of accessory muscles دلالة على وجود respiratory distress، والاكسسوري muscle اللي همه الستيرنوماستويد subcostal muscle، central cyanosis دلالة على decreased autosaturation، tympanic sound in percussion، absent of breathing sound وخصوصا في traumatic pneumothorax، tactile fremitus، agitation، diaphoresis and hypotension. لأنه هذا the pressure inside the chest will compress and decreasing the venous return to the right side, decreasing the oxygenated blood to the left side, decreasing the cardiac output and hypotension. Medical management: high concentration of oxygen، chest tube for drainage، راح نركب chest tube بحيث انه نشيل الهواء اللي تجمع، نشيل الدم اللي تجمع، ونعيد the pressure inside the chest to negative. In emergency, anything that may be used to fill the chest wound، بنسكر chest wound. Heavy dressing، needle aspiration thoracentesis in order to remove the blood, the air in the field إذا كان في مكان برا المستشفى. Connected chest tube to water seal drainage، نشبك الchest tube مع water seal drainage مع باتل، ورح نورجيكم صور كمان شوي. Any emergency thoracotomy may be also performed in the operation room. Pulmonary edema is the accumulation of the fluid in the lung, tissue, alveolar space, or both. It's severe life-threatening condition. The major cause for the left side pulmonary edema or for the Pulmonary edema results from the cardiac disease in the left ventricular failure, hypervolemia, sudden increase of pressure in the pulmonary circulation. Another less common causes flash pulmonary edema. One lung is removed surgically, the cardiac output goes to another lung. High pressure on the another lung, the fluid will escape from the vascular toward the interstitial space, so that making a flash pulmonary edema. Re-expansion lung result from rapid inflation of the lung after removal of air from lung after pneumothorax. Injury to lung tissues as ARDS, hypertension, aspiration, high altitude pulmonary edema. Manifestation for pulmonary edema: dyspnea, orthopnea, air hunger because of the accumulation of the fluid on the lung and decreased O2 saturation, central cyanosis, anxious agitated patient, foamy forte sputum, confusion, decreased O2 sat indicated by the pulse oximetry and arterial blood gases impairment. We can diagnose pulmonary edema by the presence of physical exam finding, crackles, by stethoscope, auscultation, increased respiratory rate. On chest X-ray, interstitial marking may disappear because of the fluid accumulation on the lung. Landmarks: decreased O2 saturation, arterial blood gases impairment, in which arterial hypoxemia, elevation of CO2 as respiratory acidosis. In addition to the chief complaint of the patient like dyspnea, the primary management is to treat the underlying cause. If the pulmonary edema results from left ventricular failure, we have to treat or to manage the left ventricular failure. We have to improve the left ventricular function, to strengthen the cardiac contraction by providing inotropic agent, decreasing the afterload by vasodilator, decreasing the preload by Lasix, and relaxing the patient by morphine and providing adequate oxygenation. Treat hypertension, because the hypertension is one of the major causes that lead to pulmonary edema and even sometimes to respiratory arrest. Hypertension, which means that there is increased in the systemic vascular resistance, so that the cardiac output will decrease, the blood will accumulate in the left side, so that the pressure in the left ventricle will increase, and so that the pressure in the left atrium will increase, so that the pressure in the pulmonary vein will increase. Once the pulmonary vein pressure increase, now the fluid will escape and the filtration will occur, in which the fluid and the electrolyte will move from the area of high pressure to area of low pressure, from the pulmonary vein to the interstitial space surrounding the lung, making pulmonary edema. So that once the hypertension is treated, the afterload is decreased, so that the cardiac output will improve. So that when the cardiac output improve, the amount of the blood accumulated in the left ventricle will decrease, so that the blood pressure or the blood volume and the pressure inside the left ventricle will decrease, so that the pressure in the left atrium will decrease, so that the pressure in the pulmonary vein will decrease, so that the filtration will not occur and the fluid and the electrolyte will not escape from the pulmonary vein toward the interstitial space, and no pulmonary edema. يعني عملية عكسية. Chest tube, it's used in the treatment of pneumothorax, hemothorax. It's used to establish the negative the negative pressure inside the pleural cavity. The chest tube may be inserted to the right, left pleural space, and to mediastinum to remove air, fluid, or blood.